Hello, everyone. We're here today because SolveCare and LiveMetric have just announced a partnership to bring remote patient monitoring to the next level. To find out more about this partnership, I have with us today Kelly Benning, President of LiveMetric, and James Norman, CTO of SolveCare. So let's get right into it. First off, Kelly, could you please tell us a bit more about LiveMetric?
Hi, thanks for having me today. We are really thrilled about this partnership and excited to be sharing more with the audience about what this means to care. And as far as this partnership is concerned, we have a band or a watch that does remote patient monitoring for blood pressure. And what's unique about LiveMetric is that it allows patients to take blood pressure day and night and achieve hundreds or maybe even thousands of measurements over a month's time. And it was really important to us to ensure that the user and the provider have secure data. So partnering with you means that the data lives on the blockchain, and that is extremely secure data, more secure than what most companies can offer today. And so by allowing this partnership to take place, we're putting data in the hands of users, whether it be the person actually wearing the band or the provider, that is safe and secure at all times. And we're very excited about that.
We're so excited too. Thank you. James, can you tell the audience a bit more about SolveCare?
I'd be happy to. Thank you. And Kelly, it's a pleasure to be meeting with you here today. Thank you for putting this together. SolveCare is a healthcare technology company that's we provide platforms for creating health networks. And we're really trying to streamline many areas of the healthcare system that are not very functional and efficient. That will provide a lot better care for people who really need it. As Kelly mentioned, our platform's on blockchain tech, and that provides, kind of organic cryptographically encrypted data security. We're really excited about launching these networks around the world. There's going to be a lot of opportunities for people to access care that was not available to them before, and we will have a lot better engagements from patients who are trying to access their doctors, their data, their nurses, and even family members and friends that are going to be involved in some level of their healthcare.
Thank you, James. So going a bit further into it, what matters to us is better patient-centric healthcare, right? So how does this partnership between LiveMetric and SolveCare help towards that?
So one of the reasons LiveMetric was created is because less than 10% of people are actually willing to use their blood pressure cuff. It goes home with them, and then they use it for a month, and then it sits in their drawer. And they become blind to their data, may even stop taking their medication 6 months down the road because hypertension tends to be a symptomless disease. And what we aim to do was create a band that can be worn passively day and night so that users won't have the friction of sitting down and putting on a cuff and blowing it up, and sometimes it pinches and it's painful. So what we wanted to do is create a frictionless pathway in which users could use the band. And in addition to reducing that amount of friction, we wanted to ensure that the data is electronically transmitted to SolveCare, whose then users, which are the providers, the nurses, the care teams, can look at that data in real time if they want to, and make really important care and treatment decisions. It's the lack of data that leads to long times of medication titration, or may lead to physician burnout if the physician constantly has to call that patient back in to actually ensure that the blood pressure they took at home was accurate. So not only did we create a friction-free space, but we're also ensuring the accuracy of LiveMetric results to be as accurate as the arterial line used in the ICU. Therefore, providers such as those at SolveCare can make those decisions knowing that the data is absolutely correct. The other piece that we're really excited about is that patients knowing that their data is secure means that they can look at it and share it with others. And whether that means a son or a daughter, a spouse, whoever that may be, that they want to also help be responsible for their care, they're able to do so in the Care Wallet platform. And additionally, they're able to take the LiveMetric blood pressure results and put those holistically, put put all the other results together for a holistic view of their overall health, because blood pressure isn't the only device that lives on SolveCare's platform. And so we're really excited about the ability of the user to look at their data and make really important decisions for themselves without putting all the impetus on the doctor as well. And that means whether it be that spouse or friend or themselves, they can go back to your platform and request appointments and talk to their providers about their care and really become involved in it, which is the tide that we're seeing post-COVID. Patients want to know and understand their data, and they want to be responsible for it. And this partnership makes all of that possible.
Kelly, I love how you use the word frictionless, and because we use that word a lot as well when we talk about our platform and how we talk about the user experience with that and what it really means, not just for being able to get care, but and using the whole care system involved with it, but how they're how the data becomes that individual's data. It's no longer the health system's data. It's no longer tied up in a database or an EMR somewhere. It's really, it becomes the patient's data. It becomes my data, and I get to choose with what I do with it. What our platform does is it simply makes it extremely secure, very interoperable, so it can be sent and used with other providers or other health systems if it's needed, or if you're going to share with friends and family. We are excited about the LiveMetric integration just because of the advanced information that we're going to be able to get for hypertension and cardiology patients that are going to be looking for more advanced ways of getting care and getting access to their care teams.
I'm really glad you brought that up, because that is one of the biggest differentiators that we're excited to be working with you on and helping your clinicians and users understand the data. But because you can use LiveMetric at night, doctors will have access to whether or not the patient's blood pressure is dipping 10 to 20 millimeters of mercury at night, which is a sign of a healthy heart. Additionally, recent literature has indicated that if you have surging blood pressure an hour or two before you wake up, this could be predictive of a stroke. And this data has never been available before. So we're very excited to change the way that blood pressure is monitored by giving hundreds or thousands of measurements that are secured by the blockchain and make them available to the provider and user to make really important care and treatment decisions.
Thank you. That was extremely informative. There was so much information from both LiveMetric and SolveCare. Well, how about we go to something more casual? Now, it's 2023. It's a new year. What are you most excited for this year?
Well, I'll go first on that.
Yeah.
At SolveCare, we've had some really exciting last 6 weeks. We've been advancing our product lines quite a bit, and the platform is really starting to become what we've envisioned it to be. We've got a whole new version of Care Wallet coming out, and that is going to lay the foundation for a lot of new networks and the capabilities that we can have within those networks. And we've got a fair amount of a backlog of clients that are ready to start launching. And when I look at 2023, I'm going to look at the year of SolveCare growth just exponentially exploding. For me, that's what why I work at SolveCare and why we have so much passion about what we do. Being able to offer better access to care for members all over the world is kind of starting out with a very big year in 2023.
And James, I want to echo that sentiment, because I think that this partnership speaks to what's happening at both companies. We are also expecting explosive growth this year. We received our FDA clearance in May of 2022. And so we are beginning really important commercial partnerships with healthcare enterprise, distributorships, hospitals, and payers who want to have this level of data available to them that hasn't been available before with the accuracy of an arterial line. So we're super excited about our partnership with SolveCare because of the growth that we're going to experience together. But then, of course, additionally with other organizations, especially those who are treating patients in rural areas, which we know is also something that SolveCare is very good at doing. It allows patients to have access to a provider and to their care and to their data, even in rural areas. And this has become extremely important, especially post-COVID, because we know most patients, especially in rural areas, are not showing up to their doctor's appointments. They're not showing up to the emergency department. They're letting their care go until it's at an imminent point. And so we think that this partnership and what LiveMetric is doing will help do some of those things that are happening in the communities right now in terms of heart care, and that we can better heart care for everyone, whether they be rural or urban. And for that reason, we expect explosive growth this year.
Great. Thank you both for being with us today. Before we wrap up, is there anything you would like to say to our community?
Another thing that I'm really excited about in this partnership is I had a real world example in 2020 with my mother who came down with COVID. And while as a result of COVID, her blood pressure spiked very high and to a very dangerous level. She was in the hospital and was being monitored for blood pressure level. And then she was sent home with a cuff monitor that would remotely send in her blood pressure results that she had to do several times per day. As her son, I was talking to her on the phone a lot and very concerned about what the results of such high blood pressure for a prolonged period of time could do to her. And I was asking if there were any other options for remote care that would help her. I wish that we were both Care Wallet users that had the LiveMetric device integrated at that time, because I could have had access to her blood pressure levels in real time.
That is a unfortunate story about your mom, but what's really fantastic about it is what we're looking forward to as well, which is allowing people to have the data in real time to be able to use it to make those real-time care and treatment decisions. Well, I hope your mom gets better. Here at LiveMetric, we're good. Here at LiveMetric, we're really excited this year because we are also studying 20 additional cardiovascular conditions that can be identified with the LiveMetric band. Because we use MEMS nanosensors, we collect what's called the full pressure waveform. And by the collection of that full pressure waveform, we're able to potentially identify disease states that are normally only recognized through an echocardiogram, labs, and a complaint to a provider. So these conditions, these 20 plus cardiovascular conditions, are being studied at Columbia right now, things such as aortic regurgitation and cardiac overload. So we're really excited about the level of data that we're bringing to users and providers to make really important decisions about their care and treatment. As you said, your mom was a perfect example of having this level of data where that might have been really beneficial.
Yeah.
Thank you so much for having me today. I really appreciated the time to be here. We're thrilled about this partnership and look forward to presenting the results. Hopefully we'll be back here maybe in a year talking again about the results that we've achieved together.
Kelly, thank you so much. It was great talking with you.
Thank you.
Yeah, thank you for joining us, Kelly, and you too, James. Have a good day, evening, wherever you may be right now, and thank you for watching.